Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. And today we're going to talk about the effects of marijuana on beauty, aging, and also surgery. We get a lot of questions about this because a lot of patients have questions about regular smoking versus marijuana smoking, and are there benefits? How does it affect beauty? Is it effective post-operatively to help with pain, things like that? So, a lot of this is, there's mixed kind of studies and results, but we're just going to go through some of it today and hopefully clear some of the air and get some information to you about the effects of marijuana on beauty and aging. I think the first thing I want to say is that not all smoking is the same, right? So a lot of the questions are, why is smoking cigarettes really bad for surgery and smoking marijuana maybe not as bad? And that has to do with a lot of things. I mean, there's really no benefits to smoking cigarettes. It's highly inflammatory. And the other problem with it is the nicotine. So the nicotine that's inside the cigarettes is a very potent vasoconstrictor. And so that can have effects, again, on the skin, hair, aging. And then secondly, with surgery, big risk, because what do we need for healing? We need blood flow. We need the blood vessels to be open and bring in nutrition and bring oxygen, bring in all the things we need for fighting infection and healing. So when you're smoking cigarettes after surgery, you're really limiting that blood flow and healing to the areas that need it the most. So that's why it's really risky to smoke and have surgery. Smoke cigarettes. Now, as far as marijuana is concerned, there's no nicotine in marijuana. So all of those effects that are dangerous with smoking cigarettes are not as dangerous with smoking marijuana post-operatively. And also, again, the effects on the skin. It's not a vasoconstrictor. It's not going to cause the damage and wrinkling as much to the skin. And then lastly, you can eat it. So you don't have to just smoke marijuana. There's edibles. There's other things you can do. So I think a lot of the risks that come along with cigarettes aren't as risky with smoking the marijuana or eating it. I think one other important distinction is the difference between THC and CBD, because they both come from the hemp plant, but they're very different in their effects. So THC, or the psychoactive substance in marijuana that makes you high, isn't as anti-inflammatory. It's more of an appetite stimulant, psychoactive, has the effects on the brain, more than it does overall on the body. Now, the CBD portion of the plant actually has a lot of antioxidant properties, a lot of anti-inflammatory properties. So I think as far as effects on beauty, I think that the CBD actually has some benefits. Because again, remember, inflammation, aging, combating anti-inflammation, anti-aging. So I think there are some benefits to the CBD, and we're going to go through the differences now. I think one of the things that CBD is really effective is for skin, right? So there are some studies out there showing that CBD actually nourishes the skin and hair follicles. So I think as far as skincare products and anti-aging products, I think there are some big benefits to the CBD in skincare products. And then also secondarily, like I said, ingesting it, the THC portion of it has been shown not to be highly anti-inflammatory, but actually the CBD portion is. So a lot of things that they're looking into now are the CBD, CBG, and THC with CBD. And that's a mouthful. But all of those combinations there have been showing a high anti-inflammatory effect. So if we're looking at things like post-operatively or just in general for inflammation, I think that CBD, again, may have a place for that. And I think there are some benefits to the CBD in combating inflammation. And then another question I get is, particularly for post-operative patients, is what is the effects of marijuana on pain? And is it effective with pain reduction? And it's a very interesting topic and lots of mixed results on this topic. The THC, again, is the part that is psychoactive and it binds mostly to receptors in the brain. And so they're thinking that it does control certain things as far as pain, mood, different sorts of ways the brain is perceiving pain. So it's not necessarily that it's reducing pain, but maybe changing the way that the patient is perceiving pain. And then as far as CBD, because it's easing inflammation, it's more of helping pain control locally or at the source of the inflammation. So if there was a skin treatment or some other sort of treatment, locally applying the CBD may help, again, ease the pain by easing the inflammation. As far as patients, also we're seeing patients have mixed results. How are they perceiving the pain? Is it increasing their pain perception or decreasing? I think really depends on the patient, and there's a lot of mixed results out there. Another thing in regards to surgery is post-operative nausea or feeling sick to your stomach, right? And we all know that marijuana, THC in particular, stimulates appetite, or you get the munchies, right? So patients that are experiencing postoperative nausea and taking the THC, they actually show that over 90% of those patients had a vast reduction in the nausea. So there may be some benefits there for THC in reducing nausea. Now, CBD, on the other hand, they didn't see the reduction because, again, it's more of an anti-inflammatory. It doesn't affect the perception in the brain as much. And I think most of the studies are showing that the THC is doing most of the heavy lifting as far as preventing postoperative nausea. One other thing I want to mention about marijuana is stress. So again, things that lead to aging are inflammation and stress. And there's a lot of studies in this as well, but they're showing in low doses that the effects of the THC is anti-stress, and that fact may help with a little bit of anti-aging, but then in higher doses it can lead to more anxiety or paranoia. So there seems to be that sweet spot where steering towards lower doses may actually help with stress, i.e. anti-aging. And secondly, there are a lot of people out there using marijuana to help with sleep. And again, I think there's mixed studies out there, mixed results. Does it induce a deep sleep? Is it healthy sleep? There's a lot of things out there about that. And then again, I think you have to compare that to what are the other options for sleeping aids. So I think that some of the prescription medications probably are a little bit stronger and harsher. And so some people benefit from the effects of marijuana and helping them sleep. And again, leading to better sleep, less stress. So I think, again, mixed results out there, and I think that people have to make up their own mind about if it's helping them sleep or not. So overall, I think that there may be some benefits to marijuana postoperatively or in general. I'm not saying to do it or not to do it. I'm just saying some of the studies are showing this. And overall, like I said, it's been shown to reduce inflammation. So as far as aging and speeding recovery, may have some benefits there. And then reducing stress, improving sleep, and then reducing postoperative nausea. And then I think postoperative pain, again, mixed results, but with maybe the THC and changing the way the brain is perceiving pain, maybe benefits. And then, like I said, the CBD, reducing inflammation locally at the site of surgery. And then overall, I think one of the things when I'm thinking about marijuana is the first real kind of medicine is do no harm, right? And what are the side effects? There isn't too many radical side effects of marijuana use, probably in lower doses, but anything in large quantities is probably not a good idea. But I think in the future we're going to see a lot more studies coming out looking at this, looking at what are the effects, what are the benefits, can it reduce dependence on opiates and prescription medications, what are the overall effects on aging and brain health. A lot of that still is being determined, but so far we are seeing some benefits to these things. And like I said, with CBD not being psychoactive, I think the anti-inflammatory effects, particularly on the skin and hair and overall inflammation in the body, is definitely a benefit. And it doesn't have, like I said, it doesn't come with many risks. I was going to say, unless you get the munchies and eat too much. That was how I was going to end. I don't know if am I still on?
You're still on.
Oh, great.
But that is a consideration, right? Because if you're eating things like, I feel like when people are under the influence of marijuana, sometimes they're trying weird combinations or they're craving like greasy foods or things like that, and that could stimulate issues with your skin, right?
That food can affect your skin, it can affect your weight, it can affect other things, right? So yeah, like I said, anything in moderation, but if you're smoking or eating a lot of marijuana and eating a lot of food, yeah, it can affect your beauty and health.
We see a lot of CBD infused skincare lines. Is infused skincare kind of the best path forward, or would it be better to ingest CBD directly or apply concentrated CBD onto the skin directly?
I think it's what the effect you're looking for, right? So particularly like acne and inflammation in the skin, CBD has also been shown to be a little bit antibacterial and highly anti-inflammatory. So for skin conditions that are inflammatory based, I think directly applying the CBD would be effective. And then I think ingesting it would be more for just overall inflammation in the body, say things like arthritis or maybe things that are more inflammatory based that aren't necessarily a local problem like this, like acne.
The safest way to consume marijuana for, let's say, for beauty purposes would be by eating it, right? Because wrinkles could be triggered by like puffing a joint or a pipe, like similarly to cigarettes.
Yeah, smoker's lines in the lips, yeah. I mean, if you're doing a lot of it, it's possible. I think those lines come from the pursing, but as well as, you know, like I said, thinning of the skin in those areas. I think it'd be a healthier option to eat it, right? Because any sort of smoking, vaping, that sort of a thing is inflammatory. It's going to lead to some effects in the body, so I do think the healthy alternative would be probably edibles or eating it.